But thank you. This time I'd like to recognize the gentlelady from the United States Virgin Islands, Ms. Plaskett, for 5 minutes.
Thank you, Mr. Chairman, and thank you to all of the witnesses who are here. I did not see Mr. Smith with you sitting behind you. I guess he's there to provide support and any additional information. Thank you as well for being with us. I wanted to just get straight to the questions because I know in your written testimony you give a lot more statistics and a lot more specific examples of how this has affected us. We've seen on the chart that was demonstrated by my good friend and my colleague about how the difference between what we've provided locally as well as what the federal government was provided. But one of the things that I need to highlight, and I think would be important for you to highlight, specific to the Virgin Islands, which may be different from other places, I'm not sure, that you stated that there were approximately how many people that would need to come off of the books or the support that we're receiving now if this funding ends, meaning how many people are presently that we've been able to include that no longer will be able to receive those services?
We would have to reduce upward of 15,000 individuals of the 27,000 approximately members of the Medicaid program.
Great. But I think another number that was not brought out that I would love for you to, if you have that number, is how many individuals would we like to bring on the rolls that we believe qualify for Medicaid, but we have not given those services to?
An additional 15 to 20,000 individuals who would be eligible for the Medicaid program.
So there are individuals that are presently in the Virgin Islands, maybe in other territories as well, who are just not receiving any health insurance. We have a large population that have no health insurance that would qualify, except for the fact that there is this arbitrary cap that has been put on the amount of money that Congress gives to us. And the Virgin Islands, rather than going out and borrowing money, finding other ways, we have done the fiscally prudent and responsible thing and said we just can't service those individuals. Is that correct?
Exactly. That is correct.
And how are some of the other ways that this is impacting us? If you can talk about the hospitals in the Virgin Islands. Presently, we do not receive DSH as other places do for the disproportionate share for hospitals. That is an additional bump up that's given in rural areas. Although the Virgin Islands qualifies for it and meets the qualifications, Congress and CMS have said we would not receive that. What are some of the other ways that our hospital healthcare services are impacted because and the trickle-down effect of not receiving this funding?
Well, our hospitals on an everyday basis is struggling even now. Since 2017, they have been experiencing extreme infrastructure issues. The hospital is unable, because of the limited monies that we're able to give them, to be able to bring all of the specialties and all of the specialized equipment. That is one of the reasons that the hospital has frequently called us over the last 2 years to airlift many of the individuals who go there who have real catastrophic illnesses and needing specialized procedures. So the hospital, in effect, has to turn away several individuals who have these extreme circumstances and illnesses, and we have to airlift them to the United States for treatment.
Thank you. You also, I know that our governor has declared an emergency with mental health issues and others. Can you talk about that very briefly?
Yes, our behavioral health situation is really burdened right now. Again, the need for more psychiatrists, the need for more of our individuals to have long-term care, behavioral health services. This has been hampered because of just the inequities of our hospitals and of our Medicaid program as a whole. It is very, very important for us to also have a skilled nursing facility in both districts of the U.S. Virgin Islands. We do not have skilled nursing program within the territory. Our hospitals are really burdened to provide behavioral health services as well as our community clinics.
Thank you. And finally, could you state the things that the Virgin Islands has done, things that we've put in place to provide the compliance and the accountability that Congress has asked for Medicaid? I know that there are quite a number of systems that we've put in place.
Certainly, we implemented the first ever territory Medicaid management information system for claims. The CMS also certified MAGI compliant, our online Medicaid eligibility system. We too implemented a Medicaid fraud control unit in 2018. We also implemented the TMSIS, the Transform Medicaid Statistical Information System. We also will be completing all of our cost report audit reconciliations of our 2 hospitals. We recently completed the Medicaid program integrity review, and we have a host of other programs that we have been going through for the last few years, and especially with the ACA dollars, we've been able to do all of these things that I just mentioned prior.
Thank you so much for all the work that you're doing, and thank you, Mr. Chairman, for allowing us the opportunity to highlight those for our colleagues here in Congress.